just going to go through some techniques that you might want to use with your pregnant partner for relaxation, to get the muscles relaxed, and then some techniques that you can use during labour as well that can decrease pain. So the first thing you want to do is make sure that your pregnant person is comfortable. So pretty much they don't want to be, this isn't quite as solid, they don't want to be up against something that's going to move a lot. So here it's something fairly firm, I've got good access to her back, and then once she's comfortable, you want to make sure that you're comfortable as well, because you might be doing this for hours while she's pregnant. So you might want to find something like this, which you can put your knees on. If you've got dodgy knees, think about getting a low stool, because while you could massage sitting on a chair behind her, it means that you'll probably focus on this part of her back rather than getting right down low around the pelvis and the buttocks where she probably really wants the pressure, and it's not as good for putting good body weight right through there. So get yourself something to kneel on, and then any time that you're kneeling or any time that she's kneeling and you're going to be there for a while, just think about your comfort as well. If you can put a pillow underneath your ankles and a pillow on top of your calves, so one under the ankles and one on the calves, that means that you can be really comfortable either leaning forward massaging or just sitting back and relaxing, and that's really good if she's in kneeling positions as well. So I'm going to start out with just doing long stroking ones for relaxation, and if she's done some relaxed breathing, she would be doing her nice long easy breaths out, just losing any tension, focusing on her breath, and maybe focusing on my hands. Really nice thing to do while she's pregnant, just for relaxation, or even between contractions once she's labouring. Okay, so you would just start with your hands on her shoulders and nice long strokes going all the way down to the chair and down her legs, and just doing those really long, and she'd be focusing on her breath, big breaths out, trying to stay really relaxed. She might want to actually have a bit more support for her head so that she's really relaxed up against something, so you might want the pillows a little bit higher than this, or her head across on her hands. Do you just try that, relaxing your head down a bit more so she can really let go of any tension. A couple of things I want you to notice. One is that you don't take shortcuts across here. You go all the way down to the chair and then all the way out to the side. And the other thing to notice is that I'm keeping my hands on her the whole time, because when someone is pregnant, they have high levels of oxytocin and they just keep going up until the baby's born. One of the effects of oxytocin is that, and you want oxytocin, it's one of those really positive hormones that Georgie was talking about. And so you've got those high levels of oxytocin, and one of the effects is that she can lose track of time. So it's quite common for a labouring woman to lose track of time and not realise quite how long it's all been going for, which is really nice for her. Poor support people, they probably do feel every minute of it. So if you take both hands off her, in the time that it takes you to get back up to her shoulders, she'll probably think that you left the room and you went to the car and you never loved her anyway. So don't do that, make sure, because she will feel abandoned. She won't want to feel abandoned, but something in her will just think, oh, where did they go? What's happened? And you don't want them to go into that thinking part of their brain. You want them in the nice zone. If you do have to leave her for a little bit and take your hands off, give her some warning. You'll just say, Tess, I'm just going to fill up your water bottle, and she'll probably grunt at you, and then you can go and do that. Okay, so that's, just remember, nice relaxed strokes while the mum's doing nice relaxed breathing. Really nice for pregnancy, really nice for between contractions, just to help her relax. The next strokes I'm going to teach you are Swedish massage, and this massage is to get the muscles to relax. So we are going to get in and do a little bit of muscle work. One of the things that you need to remember is that sometimes people's experience of massage can be associated with sports trainers or someone who just says, you know, let's just get those trigger points and push really hard and strip those muscles. That's not what you do when someone's pregnant. Pretty much she has to stay relaxed the whole time. So if you're pushing firmly and she's tensing up, just back off a little bit. It's always easier to do a lighter massage, and she'll enjoy it more. And it might be that after you've softened the muscles up a little bit, she will want that deeper pressure, but don't jump in there and do it fast, because otherwise she probably won't want the massage. And so we don't want you using that as an excuse for cutting a massage short. Just back off a little bit. Swedish massage does have a bit of a routine about it, and so I'm going to give you guidelines, but you can pretty much do whatever feels good for her, and sort of for both of you as well. So Swedish massage, you always start and finish with effleurage strokes. you do 3 strokes that on exactly the same spot, and then the next 3 strokes overlap the last 3 strokes. And you almost can't go too slowly unless you stop. So it is a really slow movement. You're trying to move muscle fibers. And this is where I'm doing it over nice smooth clothes. You could do it with oil and no clothes on the skin so that your hands move easily over it, but not too runny so they're slipping. And then you you could use a really thin sarong or something like that so that your hands can move freely. So you start with the effleurage strokes and you always finish with the effleurage strokes as well. Now I'm only going to do 1 of each stroke just to demonstrate it. You would be doing 3 strokes, and just to get you through this, I'm going to go kind of fast, whereas you would be going a lot slower than that. So effleurage strokes, you would do 3 from the buttocks up to the waist and out to the side, and then buttocks, the next 3 would be from the waist all the way up her back and out beside her shoulder blades, and then the next 3, and this is medium pressure, all the way up over her shoulders and down her arms a little way. And then you can do kneading strokes, and you could do these with your fingers and thumbs, but they'll get tired very fast. So it's better if you can use the heel of your hand, the side of your hand, and that little pisiform bone in there, or even your knuckles to do the massage. And so around the buttocks, it might look like deep pressure, stretching the muscles, same on the other side, or you could do them together. And just medium pressure, she'll tell you if you're pushing too hard. You do the 3 strokes, and then the next 3 strokes overlap the last 3 strokes. So you're then doing these next 3, and you would do those big buttock movements all the way around to the side of the hips, all the way across, right to the center. You would be doing those, but remember 3 very slowly. And once you get around the sacrum, you can use the side of your hand. So that's where you find the little dimples in her back, the tailbone down to the crack in the buttocks. And once you get around there and you hit the bone there, just come in close, put the pressure in and stretch the muscle away from where it's attached. So nice, you'd be doing those nice 3 strokes. And this is not hard for me, I'm just using my body weight and leaning in. When you get to the spine, you just get as close as you can to the bony part of the spine. Put your hand in really close, lean the pressure in and slowly stretching it out. Tell me to stop if I push too hard. And so you would do those all the way up. Once you get around the ribs, you might want to use that little pisiform bone here. You can just get in and be a little bit more specific. And this is often where people like to use their thumbs. And it's also often where you discover that people have a bit of a twangy muscle because there's a lot of tension, sometimes on one side more than the other, sometimes on both sides. And then you might want to do something called knuckling. So you use your knuckles either separate or together, because you've got muscles coming up like this, and you can kind of separate them out a little bit just using your knuckles. And you can do that all the way up to between her shoulder blades, or just stroking down. That can feel good. And then if you were using your knuckles, you can use those again right through the buttocks if you just sometimes get a bit more pressure doing that through here. Some of the other strokes that you can use are ironing using the heel of your hand, or again your knuckles can be really good. So ironing is when you do long strokes either along the muscle belly or out to the side, and you'll be doing the 3 nice slow strokes, slower than I'm going. You can do it right down low around the buttocks, that can feel really good, or even just use your knuckles to go all the way out to the side. And you balance it by making sure that you do that same thing on the other side as well. You can do it around the belly, around to the baby at the front. And then sometimes doing those strokes in opposite directions can be quite balancing. So they get the 3 strokes that way, and then the 3 strokes the other way. And as you bring your hand up around her neck, you might want to start just giving those shoulders a gentle squeeze up and over here. And then some of the techniques that you might want to use for the shoulders are wringing, and this is where it is like you're wringing out a towel. So you're pulling the muscles one way, pushing the muscles the other way, and you can do that on those nice long muscles like the calf or the trapezius muscles up here. And you just come right out to the point out to the side, pull the muscles one way, push them the other way, and you're just pulling and pushing to get that one in. You would do that, again, 3 of each, all the way up to the base of the neck, and you do it on the other side, all the way up to the base of the neck. And then once you get to the neck, you'd actually be better just doing both sides together. So having your fingers either side, pushing in one direction, pulling in the other, 3 in one spot, and then moving up, getting 3 all the way up to the base of the skull. Because of the postural changes in pregnancy, quite often pregnant people hold a lot of tension around where the neck muscles attach to the skull. So doing tiny little circles from the bone behind their ear all the way around to the bone behind the other ear. So doing those tiny circles all the way around can be good. Another stroke is picking up, and this is where you're pushing the muscles down where they're attached and then lifting them up and away. So it's not pinching, but it's pushing and then lifting away from where they're attached to the bone. And you can do that again along the trapezius, either side of the neck, just sort of pushing down and lifting that up and away, and doing that all the way up to the base of the neck. Another really good stroke to do that is much better if you have oil is using the side of your hand and doing a long stroke all the way down from the skull all the way down to their shoulder, doing quite firm pressure. Another one that can be really good is quite often getting the muscles here hold a lot of tension. So using that side of your hand to push across where those muscles are. And then everyone kind of gets into doing this one, which is great because it does mean that you can get some of those trigger points, and because you did all those other strokes, you've softened them up. And she might have some tense spots all the way down between her shoulder blades, right up and across. And so you can actually start those right down low. If your fingers get sore, you can just use your fingertips and do just reinforce them and do little movements all the way up. Or you can just reinforce and go up and over the shoulder like this as well. Okay, and then if you've done something like that and she's been a little bit tense, those long stroking movements are good again to do those. The other one that can be really good just to get muscles to let go is to get in as close as you can to the spine. Put your thumb or your fingertips as close as you can, and just don't move over the skin, just move the muscle as close as it is attached to the spine. Just very gentle, 2 or 3 firm strokes, and that can really help muscles release. When you're using your thumb, you don't actually want it to go into that position. You want to keep it a little bit straighter just to protect your thumb joints so you don't come away with sore thumbs. And again, you can reinforce using the fingers. Some people use their knuckles, or there are lots of different massage tools you can use. So that there are roller balls that mean that can take a bit of the work of your hands. And one that we like to use for labour, but also just for relaxation in pregnancy, is a pool noodle. Now, I don't actually have a pool noodle here, but I've got something that looks a little bit like one. This is a physio roller. This is not exactly what we recommend, but we use it in the same sort of way. So go and buy yourself a pool noodle, cut it in half again, and it's just the right density to do some really good firm massage. So you just use your body weight, lean into that, and do nice pressure coming up the back. And lots of mums, particularly if their partner isn't really kind of getting this massage thing that well, feel that pool noodle massage and they're like, oh, we're going straight out and buying one of those because they feel really good. So just go and get one. You can give all the spare bits to your friends who are having babies as well. Okay, so you get to go and practice that, and you would finish off with effleurage strokes. So again, chair to the waist, nice and firm out to the side, 3 of those, and then 3 coming, I'm just going to hold on here, coming all the way up the back and out to the side, and the last 3 coming all the way up over the shoulders and down to the side. And the reason it's really good to finish off with those strokes is because sometimes you get 15 minutes of massage and sometimes you get 50 minutes of massage. I think you just have to think, okay, the support person's going to give me as much massage as they feel up to giving. And it means that when those effleurage strokes start, it's a bit of a signal between you that, oh, this lovely thing's going to finish. And you can just say, look, as soon as that starts, could you just get that spot between my shoulder blade? It's just still a bit sore. You can do 2 more minutes massage there and then go ahead and finish with the effleurage strokes. And it just seems to help with the grieving process. So it's very sad the massage is over, but at least I get those 9 strokes to kind of finish it off. a lot of pregnant people will just want massage around their low back. And if that's your partner, that's really good. Do most of your massage around there, but try and finish off with the FRR and start with the FRR strokes that come up and across and all the way over. Because if you don't, your body doesn't feel quite right. It's a bit like having one foot massaged. The other foot is not happy until it gets massaged. And so you want to do those FRR strokes so that the upper back is not just a bit grumpy, and it just finishes the massage off properly. So you can go and practice your Swedish massage to get muscles to relax. And we recommend that you do that at least 3 times a week from, well, all the way through pregnancy would be lovely, and more is better, because although I'm doing this through clothes, we know that skin contact increases oxytocin. And so lots and lots of lovely skin contact, getting massage and feeling good will increase your oxytocin, and that's the hormone that's going to put you into labour. So we want lots and lots of this oxytocin, and we want those muscles relaxed because she's carrying baby around, and that puts that much extra load on her body. Okay, I'm now going to talk to you about some techniques to decrease pain during labour. And I've had 4 babies, and these sort of things definitely helped for me, but I've only seen 3 other births, so I'm not an expert on what happens in labour at all, but I do ask every midwife that I work with, what do you think works in terms of massage to get rid of pain during labour? And the number one thing that they say works is actually just pressure. So most often you'll just put your hand onto her back, probably in the middle, and just put really firm pressure. It's probably going to be right down low around the sacrum. You'll just push that and you'll hold it there for the whole contraction. And that might work because you're pushing firmly where baby's pushing from the other side, and she's just locking into the sensation of your hand instead of the stretching that baby's doing. And that means she can relax around the contraction. So that is the most common one. Just that really firm hold. If her hand is on her back, your hand needs to go there. If it's off to the side, that might be just where she needs the pressure. Quite often it will stay the same spot, so you can borrow the midwife's big black texture and just put a little mark on there so that you can get back there really fast, because she'll want pressure for the whole contraction. So just holding the pressure is really good. Some women like rocking back pressure, and if she's been labouring and found it really good to do lots of movement and rocking, then but she's too tired now, she can't even sit on a ball, because if she does, she's going to fall off. And so you can do that for her. If she was having a contraction and she was trying to wriggle a little bit, you might want to do this rocking back pressure where you just put your hand in her lower back and you do that rocking for her. So you're just going to very gently rock back and forth. Another technique that can be good is serotonin release, and this kind of comes instinctively. So quite often if little kids hurt themselves, or if you've got a crying baby, quite often we will rub or pat that to make it feel better. We might rub things to make them feel better. And this serotonin release can be really good around that lower area near the pelvis, over the low back, and just quite vigorously rubbing to release that serotonin can be really good to make her feel better. Don't give her a Chinese burn, but quite firm rubbing over there can be good. And then there are 2 more techniques, and these are a little bit harder for you to figure out. So if you just look very carefully where I put my hands. The first one is a hip hold, and this is where it's not up high around the hips here, it's right around the buttocks. And you're going to spread your hands as much as you can, because if you just put pressure through the heel of your hand, it will probably get sore underneath there eventually. So you want the pressure to go all the way through, but not really through your fingertips, otherwise she's going to get a bruise. And it will have your fingerprint marks on it. So the hip hold, you spread the pressure, you come not up high, right down low around her buttocks, and you squeeze and you hold that for the 60 to 90 seconds of the contraction. You're just holding it, breathe, because it is quite hard work and no one's going to care about your sore arms. You just have to hold that, you get a break with the next contraction, and then you can relax. This hip hold can also feel really good for women who are getting back pain or pelvic girdle pain while they're pregnant. So just holding on, and obviously if anything hurts, you don't go ahead and do that. So just really firm and then let go. And in amongst all this, just be aware that some pregnant people, when they're labouring, don't want to be touched at all, and that's fine. Don't make her feel that she has to have her massage. yeah, just be thankful that your arm's going to break. So you want to do that because it really can help to block out pain. And that might be because you are kind of changing the dimensions of the pelvis a tiny bit, or maybe it's just that she literally feels like you've got my back. You're holding on to me so I can go through these contractions. And then the last one is a sacral hold. So to find the sacrum, if you just run your hands down her back and you find the little dimples in her back, so you just have a look, those little dimples as you come down, there's two little dimples there. So you've got the dimples, you go to about the crack in the buttocks, which would be about there, and this triangle is about where your sacrum is. So you use the heel of your hand and you're going to place it, there's my sacrum line, you're going to place it on that bone and slide off the bone into the buttocks. And so once it goes soft, oh yep, there I am. And then the other side underneath, and then you're going to squeeze those together. So you squeeze, I'm pushing in this direction. I'm not doing sideways holds, I'm not pushing up, I've got that bone. And some people kind of come from here, but that's not quite as good because there's quite a bit of flesh. And you're really wanting to push this joint here, you're trying to jam it together. So you've got little dimples around about the crack in the buttocks, hand on, yep, there's the bone, slide underneath, and you'll be ready to push in that direction. Slide underneath, same on the other side, and you squeeze that up and together. So it's not through my fingertips, it's not the side of my hands, the pressure just comes up and across, and you hold that, and you don't let go until she finishes having her contraction. And that works because it helps to block the messages from the nerves getting up to your brain, or and telling it that it hurts down there. So it can actually block off the pain there. So for some people, they can have that hold and just breathe through contractions or just use the gas. And for other people, none of these things work. And then Georgie will talk to you about some alternatives, that they've got some medical things that you can do. So you need to practice these. You need to practice the regular massage regularly, 3 times a week ideally, or more. Often she'll get her massage lying on the side of her bed, and just make sure there's lots of pillows piled up in front of her so that she doesn't face plant when you push really firmly through her back. So you get to go and do lots of practice with that, lots of massage, and they will remember what a great support person you were doing all those great things, because women remember things and they feel the same emotions as when the thing happened. So hopefully she'll have lots of good memories of you doing great massage, and if she needed it, those holds that you can do through labour as well. Thanks, and good luck with your labour.